Welcome back to another Score Builders question and answer video session. This video provides members of the Score Builders team with the opportunity to explore challenging multiple choice examination questions with students actively preparing for the licensing examination. My name is Scott Giles, and I will be your host for today's journey. I will read the question and provide you with an additional 60 seconds to answer the question. Ready? Let's go. A patient with a genetically inherited neuromuscular disorder reports weakness in their hands and feet with normal strength elsewhere. The patient experiences difficulty with grasping objects and demonstrates a steppage gait pattern. This clinical presentation is most consistent with which of the following medical conditions? Option 1, Guillain-Barre syndrome. Option 2, Charcot-Marie-Tooth disease. Option 3, Post-polio syndrome. Option 4, Huntington's disease. Nervous system pathology. Pathology of the nervous system can be caused by a variety of different factors. Some etiologies include mechanical trauma, for example, carpal tunnel syndrome, thoracic outlet syndrome, hereditary inheritance, for example, Charcot-Marie-Tooth disease, metabolic diseases, for example, diabetic neuropathy, and viral infection, for example, Guillain-Barre syndrome, post-polio syndrome. This question is asking you to identify the medical condition most consistent with the described clinical presentation. Stated differently, looks like, sounds like, smells like. Questions like this are common on the NPTE. In fact, there's an entire content outline category called Foundations for Evaluation, Differential Diagnosis, and Prognosis, which represents approximately 33% of all NPTE questions. Let's explore each of the options. Option 1, Guillain-Barre syndrome. Guillain-Barre syndrome has various clinical presentations, though the most common subtype is characterized by weakness that begins distally and rapidly progresses to involve more proximal musculature. Guillain-Barre syndrome is not a genetically inherited condition. The exact etiology is not known, though its onset has been associated with bacterial and viral infections, surgery, and vaccinations. Option 2, Charcot-Marie-Tooth disease. Charcot-Marie-Tooth disease is a hereditary disorder characterized by motor and sensory neuropathy, progressive muscle wasting, and diminished deep tendon reflexes. The disease initially affects the ankle dorsiflexors and everters, resulting in foot drop and thus a compensatory steppage gait pattern. As Charcot-Marie-Tooth disease progresses, it involves the intrinsic musculature of the hands, leading to difficulty with fine motor tasks. Option 3, Post-polio syndrome. Post-polio syndrome refers to new neuromuscular symptoms that occur years after recovery from the initial episode of poliomyelitis. The presentation of weakness can vary, but it's usually focal and asymmetric. Distal musculature is not necessarily affected more than proximal musculature. Additionally, post-polio syndrome occurs as a result of a viral infection and therefore is not a hereditary disease. Option 4, Huntington's disease. Huntington's disease, also known as Huntington's chorea, is a genetically transmitted neurological disorder of the central nervous system and is characterized by degeneration and atrophy of the basal ganglia and cerebral cortex. Huntington's disease initially presents with involuntary choreic movements and a mild alteration in personality. As the disease progresses, gait will become ataxic and a patient experiences choreoathetoid movements of the extremities and trunk. Speech deterioration, unintentional facial expressions, for example, grimacing, tongue protrusion, and mental deterioration are common. The correct answer is option 2. Let's explore the all-student data. 26% of students selected option 1, Guillain-Barre syndrome. 44% of students selected option 2, Charcot-Marie-Tooth disease, the correct response. 5% of students selected option 3, post-polio syndrome. 25% of students selected option 4, Huntington's disease. System classification. This question is a neuromuscular and nervous systems question, which represents approximately 24% of all exam items. Content outline classification. This question is a foundations for evaluation, differential diagnosis, and prognosis question, which represents approximately 33% of all exam items. Level classification. This question is a level 2 question since the question requires students to integrate numerous pieces of information or to apply knowledge in a given clinical scenario. Remediation of level 2 questions occurs by increasing flexibility with academic content and by carefully analyzing decision-making processes when answering applied examination questions. Thanks for joining us on the Score Builders question and answer video session. See you next week.